My name is Sonia Moore, and I'm a community health specialist, and I'm also a Newport High School graduate of the Project Lead the Way Biomedical Sciences program. Yeah, so I did the Project Lead the Way program throughout my high school career. I started in the Principles of Biomedical Sciences program, which is the one where you follow a fictionalized crime scene and kind of learn about the different careers within it. Some that we focused on in my class were the 911 operator and medical examiner, as well as some of the ways that the fictionalized person could have died by gunshot wound and looking at blood spatters, and then also by disease like sickle cell disease or diabetes. The second year, we focused a lot on human body systems, especially like the skeletal system, as well as the brain. The third year was the medical interventions class, in which we did a lot of labs like gel electrophoresis and PCR labs. And then the fourth year was the biomedical innovation class, where we did kind of a lot to pull together everything that we had done and learned in the last classes, including we designed an ER that was kind of based on whatever community we chose to do, whether rural, urban, suburban, and kind of looked at all the different pieces that it would need and what communities it would serve and how it could best serve it. Yeah, we definitely learned about a lot of different careers. In the program, I think each year we did little career journals in which we focused on a specific career that we got to choose and kind of researched it to figure out what that career was, what it would entail, what education it would require, what the salary range might be. And it was all just kind of based on what we wanted to do, and then we would look at different schools that would maybe offer those programs and whether those were virtual, online schools and classes, or if they were in person, and just kind of learn more about different career paths that way. Absolutely. Yeah, if it hadn't have been for Project Lead the Way, I don't think I would be here. When I was a freshman in high school, I wanted to be an architect, which, I mean, nobody really sticks with what they want in high school except for a very select few people, I think. I was not one of those people. I did do the Project Lead the Way Biomedical Sciences program, in which I got to do a lot of different labs. I knew that I didn't want to be a doctor, a nurse, or a pharmacist or anything like specifically providing care. But I did kind of want to work in the health fields. I thought that was very interesting. And through the Project Lead the Way Biomedical Sciences classes, I was introduced to the student organization HOSA Future Health Professionals. And that's kind of the thing that brought me into the health field even more. So I was able to meet a lot of different students from across the country who were also interested in different health professions, whether that was the mathematics and research side or being a doctor or neurosurgeon or whatever. And through that, I was able to learn a lot about public health. I think 2 years ago, I got to do a Public Health Leadership Scholars program, which was hosted through HOSA in joint with the Office of the Secretary for Preparedness and Response, as well as the Office of the Surgeon General. And there were about 10 of us chosen from across the country who got to participate. We all went to DC for a week and got to learn about public health from different public health professionals, from some agencies that we all know, like FEMA, Medical Reserve Corps, and then others that are a little bit more obscure or less well known, like the Biomedical Advanced Research and Development Authority and the Office of the Assistant Secretary for Preparedness and Response. And it was just fascinating to see all of those different careers and different things that were part of public health that I didn't even know. And I definitely wouldn't have had that experience without Project Lead the Way leading me to HOSA.